Peace and welcome to another episode of Black Talk Radio News. I'm your host, Scotty Reid, broadcasting independent black media with a mission: truth before propaganda and people before profits. Before I get into my topic of this episode, if you support the production of independent, non-corporate media, then go to blacktalkradionetwork.com, where you can find other podcasts with other great hosts with great topics and information. But you can also make a donation by just hitting the donation tab, which you'll find again at blacktalkradionetwork.com. So today I want to talk about a major lawsuit that made some headlines earlier this month, but somehow I missed them. Those headlines were about UnitedHealth Group, the largest health insurer in the United States, which is being sued by its own investors. Now, let's not think that this is some David versus Goliath situation. Let's break it down. This isn't about justice for patients. It's about rich investors angry they didn't make enough money off a system that profits off of the suffering of the population. Let's talk about what's really going on. The lawsuit basically tells on itself. Back in December of 2024, you remember, it was wall-to-wall news coverage. UnitedHealth CEO Brian Thompson was assassinated in the streets of New York. And in the months following, the company began quietly shifting away from some of its most aggressive cost-cutting tactics like denying medical claims en masse and squeezing profits from Medicare Advantage plans. Now we get to the root of the problem, and that problem would be, fast forward to April 2025, UnitedHealthcare drops a bomb on its shareholders. They change up or revise their earnings forecast downward. The result, their stock crashes over 22% in one day, wiping out almost $120 billion in the stock's valuation. That's what this lawsuit is at the heart of it about. Not about denied surgeries, not about people dying from preventable illnesses. It's about billionaire investors not getting rich fast enough. The real problem is the for-profit healthcare system we have here in the United States. This lawsuit is just the latest symptoms of a disease that's been festering for decades. America's healthcare system isn't broken, it's working exactly as it was designed, as we've heard many times from many people, to serve capital and not serve its patients. UnitedHealth and companies like it don't just make money, they make money by denying care. So there is some ethics to this. Their business model depends on people getting sick, but not too sick, and definitely not too expensive. So you think about that. Meanwhile, people across this country are forced to ration insulin, delay mammograms, avoid ER visits, or go bankrupt trying to survive a health crisis, especially one that involves cancer. That ain't a system, that's organized cruelty. Cruelty for profit. And the cruelty is the point when healthcare is a product sold to the highest bidder. Now let's do a global contrast of healthcare and what it could look like. If we look beyond our borders and go to places like, and look at Cuba, healthcare is a human right. It's free, it's preventative, and despite being under one of the longest running U.S. blockades in history, because they dared to exercise their right to self-determination, they've achieved far better health outcomes that rival or even surpass the United States. Think about that. Think about where their priorities are, even with the little that they have as a result of an evil blockade meant to punish the people for not choosing a different form of government. It's just cruelty, and that's all we see in U.S. history. But let's take a look at China. China's supposed to be the big evil communist boogeyman, but they've created a massive public health infrastructure which covers hundreds of millions of people. And they do it through government-backed insurance. Even as they integrate private providers, basic health care still remains subsidized and accessible. Now, if we look across the Atlantic into Europe, countries like the UK, France, Norway, basically all of Europe is subsidized by U.S. taxpayers, NATO and what have you. But those three countries all have some form of government-funded healthcare and deliver better results at a fraction of what people are forced to spend per capita here in the United States. And no, people don't have to mortgage their homes for a hospital stay in Europe. We are the only so-called, quote unquote, developed country where health insurance is traded like oil and weapons. And also, let's not forget about the prison slavery stocks that's all traded on Wall Street. Let that sink in. My closing thoughts are, what side are you on this issue? Okay, what side are you on? When investors are suing UnitedHealth, what they're really saying is we want the company to go back to denying more care. Let that sit with you. What's most important to these people? All right, so we need to be crystal clear. Healthcare is a human right, and it should never be left to the mercy of shareholders, lobbyists, or profit margins. In my opinion, if we want to live in a country that values life over luxury yachts and private jets, we have to dismantle the for-profit healthcare model and replace it with one that serves the people, all people, regardless of income, whether that's Medicare for all, single payer, or a nonprofit cooperative system. We need real change. People are dying, literally, not corporate PR bandages on a bullet wound. So that's all for today on Black Talk Radio News. Again, I've been your host, Scotty Reid. And remember, if the media won't serve the people need to create their own media. You can support independent Black media and this platform by visiting blacktalkradionetwork.com. Make a donation, hit the donate tab, share the truth, share the platform, speak the truth, and live the truth. Until next time, stay safe out there behind the enemy lines of USA Inc.